Welcome to the Swike Podcast, the only podcast that shares the stuff you didn't know you needed to know about jobs, careers, and life. The Swike Podcast, the stuff I wish I knew earlier.
Hi, everyone, and welcome back to another episode of the Swike Stuff I Wish I Knew Earlier podcast. We're here again with our gracious guest host, Aram, who's going to go into a little bit more into nursing. And today's topic, we want to get into nursing school and the experience that she had and maybe some of the stuff that she wished she knew earlier when going to school and maybe some of the parts up to it. So Aram, if you don't mind sharing a little bit about kind of your educational journey into nursing. So my understanding is you went to UT Scarborough for an undergrad, you went to Michener in between, and then nursing school was actually in Ryerson. So can you walk us through kind of the journey through that? What was kind of the most helpful, most challenging, and like, did you need to do all that schooling, or was it just more part of your journey to explore where you wanted to be and whether or not nursing was for you?
Well, I think that it was exploratory, but I also think I needed that. And, because when you go straight from high school, you're really young, you're still figuring things out. I went to U of T Scarborough. I like I said in a previous podcast that I wanted to do cancer research and the possibility of medicine. I did my first round in my first year wanting to do cell molecular biology, which was great. It was really tough. It was hard, but it was an amazing experience. But then I got into more of the idea of neuroscience and what else there could be out there. So I went through my journey, I graduated, and then I thought, okay, well, how can I apply this? Because then I realized maybe research is not really my cup of tea. I mean, it is, but I know I can do more, and I really want to see if I can apply myself out there. So that's when I started doing more exploring about other healthcare professions, and one of which was respiratory therapy. So that was with Michener and University of Toronto. So with respiratory therapy, that was a different healthcare profession, of course, dealing with patients at the bedside, but more of an advanced care for patients. So putting in breathing tubes, setting up ventilators, putting in arterial lines, things like that, for example. And it was a good experience. And I had my clinical practicums and whatnot. And that was all great. But then I wanted to do more exploring. And I said, okay, so there's this part of it as well. But how else can I go out there and really expand myself and really use my skills? So then I discovered I wanted to try something else. And I thought, okay, you know what? Let me try nursing, right? Like, it was always at the back of my mind. I was like, okay, let me try nursing. And maybe I'll try a different school just to get a taste of it, because I've already had the experience with U of T. So let me try elsewhere. So I decided to try Ryerson, and I did. And I loved it. So, I had the 4 years. Of course, they had the other accelerated programs, but I did the 4 years and I wouldn't change it, to be honest with you. It was more, it was more spread out. And then, of course, you got more into the depths of understanding what's for you and what's not for you. I mean, and that could be for anybody as well. But when you have an accelerated program, you don't really have too much time to really think about, okay, is this really for me or not? Because you don't have much exposure as you would if you have it spread out over 4 years. What I would say is that U of T, and I went to the Scarborough campus, was more of a tight knit, more smaller community. But it was great and I really loved it. I think what was a little different about the other two schools was, of course, I had gotten to a program that requires, hands-on clinical experience. So of course, I had the experience of not only going into labs more often and simulations more often on campus, but it was also going out into the clinical field and seeing what the profession is really about versus what they tell you in the textbook. And I think also what was really different was the atmosphere. It was more of a downtown core atmosphere, which was very different as opposed to being at U of T Scarborough, which was in the suburbs in the East End. But I would say overall, like, the entire experience at all three was great. It was amazing. I wouldn't change it.
That's great. So what I took from that is your journey was a little bit more roundabout than most who would have known that nursing is kind of for them. But obviously, you weren't one of those people. You didn't know like straight into undergrad that you wanted to do nursing. You were more interested in cancer research and things like that. So that kind of detour at Michener was kind of well received, and then you made the most of that opportunity to learn a little bit, and possibly some of the practicums helped you to say, okay, yeah, actually this part relates quite readily to nursing, and it could be quite appropriate for me to go into that. And yeah, but someone who already knows that they want to get into nursing might skip kind of that middle thread and
Right.
just continue on. And for folks that are looking to choose schools, then you should probably take a look at, well, are they giving you hands-on experience and how much of that? And it's just more of a personality fit, like suburban versus downtown. That's often just a personal choice for folks, but you benefited from that. So that sounds like it was a great and interesting journey. But if we kind of go into what set you up for success in that nursing program. So you did the undergrad, you did kind of the term at Michener. Like how did that help, or how did that hinder things in terms of like progress, or could folks be better served or differently served if they went like straight into nursing school?
Well, I mean, you do have the option to go to nursing school straight from high school.
Mhm.
But what I do think is that I had the exposure prior to, so I already had the clinical practicum experience. While I was in nursing school, I was actually working in a cardiology firm as well as nuclear medicine. So I already kind of had that exposure and that experience. So things were not as hard as it was for some other folks, where it was like difficult for them to kind of open up and speak to patients, or even when we had clinical exams in nursing school where you actually had to go in, introduce yourself as the nurse that was going to do a head to toe assessment, or the nurse that was going to do a procedure, like during our simulations. Like, it was nerve wracking for a lot of people. And don't get me wrong, I mean, that's just a natural anxiety that you have prior to a test or an exam. But I think that it kind of eased me a little more with the comfort level of how to speak to a patient, how to interact with families, how to approach myself in the clinical setting as a student, but also in simulation. So I think that kind of ease that barrier for me, and kind of like the understanding of things like basic vital signs, the very main key but very basic thing to know when you first enter into nursing school, and then going more and more into it. So I wouldn't have changed that at all.
That's great. And one thing that, or a question that came to mind was, because you had kind of that undergrad and the Michener experience in between, then that kind of puts you a few years kind of behind, quote unquote, if you were one of those people who went into nursing school straight in from high school. So is that a difference, or does that have an impact? Because you might have someone who was like grade 12 the year before, who was a classmate, right? Is that even a thing? Does it matter? It seems like it was a benefit for you because you had a whole bunch more experience. You were able to kind of position yourself much easier and better in front of patients and things like that. Or was it more like, well, they expect folks to be kind of the young, just out of high school type of thing? Or were some of the challenges was age and maturity a factor in kind of the schooling that you had, the nursing schooling?
You know, honestly speaking, and like I've said before, I don't believe in timestamps. You can go anytime you want to, to pursue anything that you want in your life. I think that having a certain age of completion of a degree, or a certain like milestone in your life, is just something that society places as a norm for everybody. You're meant to kind of accomplish something when you're meant to have that.
Mhm.
Like, I have colleagues of mine that have, done the degree prior to, they went straight from high school. And yes, maybe the only difference would be that they have a few more years of experience versus me. But I don't think that that really affected myself, for example, in terms of understanding how to take care of a patient or how to do certain things. I mean, maybe the first few weeks when I first went out on my own and started working as a nurse, but but again, like, because I had that exposure already, and because I had become so accustomed and really into it and gone into my own thing, and you'll hear about nurses having their autonomy to really work and have that good sense of clinical judgment. I had that exposure, so I don't think that it really hindered me. I think that more of the experience helped me move further. And surprisingly enough, I guess to some people, would be that even sometimes I knew more than what some of my colleagues did.
Mm.
Even though they had graduated much sooner than myself.
Yeah, that's good to know, because there are some industries or some professions where there is a bit of kind of ageism, where they want kind of the younger folks. So the ones that come to mind are kind of like marketing or computer science, where they want kind of the young, like, hacker person who can code. And when you're older, they don't see you as being more accomplished. And like marketing, well, it's the young kids who know, like, Instagram and social media and all that sort of stuff. And if you're older, that experience doesn't necessarily help. But it sounds like in nursing, actually, it's a benefit for a lot of folks, because really, yeah, with the care and wisdom and the understanding, I mean, there's so much to know. And having done that in a different context and in a different undergrad or whatever, can be much more of a benefit. So it is definitely one where folks who are worried about a timestamp should probably thrive in if they're considering that. So that's awesome. So take us back to kind of starting nursing school, right? So your first couple of days, you've already had a couple of well, undergrad degrees or postgrad degrees or but previous schooling. How does kind of the first few days or what is that nursing school experience like for you?
I mean, the first few days, like, everyone's kind of like hustling and bustling. You're going into your classes, and like everything is just like, whoa, okay. Like they're like, okay, so, welcome to 101, whatever the course was. If it was theory, it was practice or whatever. And, they would say, they'd introduce themselves as the professors. Sometimes they would get like previous students, like in their second or third year, to come in for like maybe 5-10 minutes, do a quick spiel on, what the course was about and how first year was about. And then of course they told us, like, okay, so here's the course syllabus. So, this is what's expected of for this semester. And you have to read all these books, and you saw these list of books, and there were like 80 pages or more per week. And that was just like for one class at one course. And you're like, oh my God, what am I going to do? Oh my God, I haven't even gotten my books yet. But what was interesting was that, you sat down next to someone and you're just offhand talking, and then you just became friends with them, and you just end up being friends with them for like so many years thereafter, and you just never knew that. It's not like where you were at U of T or like a larger campus, right? And again, don't get me wrong. Like, I mean, large campuses are awesome. But when you have more like of these professions, you kind of get to know more of your colleagues a little more in depth. And like, back in the day when I went to U of T, you sat next to someone. And I remember at U of T, when I sat next to someone, the professor would say, look to your left, look to your right. Next year, you'll see that person's not in sight. So they basically told you you're doomed, because maybe this is not for you. But in nursing school, they were like encouraging us to actually become very collegial with one another. And they even encouraged us to call them by their first names, the professors, because they told us, we're not only like instructing you, but we're going to be colleagues. So it was more of a closeness that they were trying to establish. And then, you'd be sitting next to someone making offhand jokes and whatnot. And then who'd have thought you'd be friends, like for many years, you'd be texting each other. You'd see like someone getting married or whatever the case is, or you bump into someone like 5 years later. You're like, oh, I didn't know you were working here too. And, you'd kind of make the offhand joke of like, oh my God, like, look at all this. I haven't even started to like, and the next person's like, dude, I didn't even buy my textbooks yet. Don't even go there. Like, so, I mean, like, I'd say the first week or two was like, okay, I got to get my books. I got to get studying, like, but I would say it was a very different experience. when I went into like respiratory therapy and nursing school. That's kind of like how it was. But of course, you had to catch up on your readings. You had to get going. Whereas at U of T, like, yes, you had to catch up on your readings, but they kind of expected you to start those readings like yesterday before class or the week before. And that's good, right? Because they're encouraging you to become so focused into studying. And not that nursing didn't, but I think they gave you a little more leeway because they were like, okay, well, some people are mature students and some people are coming straight from high school. Let them get a chance, like, to get in there and really go through it. They're new. But like, when you went to like U of T, for example, like, which is a great school, it's an awesome school. But there was more standards on that. Like, you had to make sure that you had everything done ahead of time in class. And, I think some people like, and I think it was the rare one out of like 1,000 in the class that had maybe already started on the next chapter, whereas everybody else is like still struggling to still go through that first one that, nobody finished and were even trying to finish assignments for other courses. So I'd say that's what the difference was.
Right. So what I took from that is, I mean, compare and contrast to other programs where there's a lot more like collegiality in there, where, it's not the competition of look left and look right, and they won't be in sight.
Yeah.
It's more
Yeah.
becoming friends, even by the first name. I think that's great. So maybe it's by nature of the profession and being more supportive. And I'm wondering, like, from a let's say class size progression perspective, because oftentimes you'll go to one where like you have a huge hall for your first year, and then by like fourth year they're like classes of 10 or 20 that sort of thing. Is it kind of the same thing, or is it like, no, we started with a class of 80 and we graduated with a class of like 70 or something like that? Is that kind of more typical, or what were class sizes like, and was it sounds like it was a little bit more intimate, but how did it vary kind of from year to year?
I think similarly, when I went to U of T, Michener, Ryerson, the class sizes in the first year were incredibly large.
Sure.
But as you went through the years, like, I guess people made their changes, people didn't like it anymore, or personal circumstances that they had to deal with, the class sizes got incredibly small, to the point I think the most you'd have in one class was maybe like 40, 50 people.
Okay.
So yeah, if I were to remember that quite correctly, that's exactly what you would have seen. And in the end, for example, in nursing school, when we had our orientation, they like for our final year of orientation, because that was the year where you strictly only did clinicals and you'd go to class and submit assignments, and you'd be in touch with a faculty advisor, but your main goal was just finishing your clinical practicum or your consolidation. They had the orientation with all three sites. So Ryerson's nursing program is affiliated with, of course, the people on site with Ryerson, Centennial College, and George Brown. And that had filled the entire auditorium, which was probably about maybe 300 to 400. And that was across all three sites. So you can kind of get a guess at how many students must have been from each site in the final year. So like I said, the numbers kind of just cut down over time.
Yeah, I think that sounds pretty standard, and I guess even with that collegiality, it's not that everyone's going to stay in the program, because everyone has their own personal circumstances anyway to make the decision and whatever. It's not necessarily just hey, I have a friend there, so I'll stick it out because Aram was helping me out in first year. If they didn't like it, they didn't like it, right? They'd have to make the decision on their own.
Yeah.
So if you're able to kind of give yourself some guidance, first year, second year, third year, fourth year, whatever year that you want, like what are some of the thoughts that you'd share with yourself in starting nursing school?
Well, there's a couple of things. So I would say the first one is take it one day at a time. Mm-hmm. Take it one day at a time. Take it 1 hour at a time. It's not easy. It's not easy in the beginning. Like you'll feel flustered at times. You're going to have your good days. You're going to have your bad days. But just take it one step at a time. It's life. It's life. So, you don't know what to expect. Nothing is predictable. Nursing school is not easy. You'll already be given so much material to read, so much material to study. You'll have books galore. You'll have to read several chapters. You'll have to review. But you need to take it one step at a time. And I think what's also important is understand your learning style. Do you like to record things and listen to them? Do you feel that lectures are beneficial for you? Do you like doing diagrams? Do you like making diagrams? Do you like making Venn diagrams? Do you like making concept maps? Some people study best with concept maps. Some people just like to read. Some people like to study with music on. That enforces their memory, for example. So I think that kind of all helps in with it as well. And understand your limitations while you're at it. While you're going one step at a time. At the end of the day, like, your goal is to get that degree, to finish your clinicals and graduate. That's like the ultimate goal for pretty much all individuals that are in nursing school. But take one step at a time. Everyone really wants to go for that golden apple, but take one step at a time to get to that. It's not going to be an easy process, but with the guidance of, and support of your colleagues, I think that can also help. And if you need help, always make sure that you ask for it. If there's something you're not quite clear on, ask. Send emails, make friends in class. And I think that's another thing that's really important, is make friends. When you walk in your first day, make sure that you make some friends. Even if it's the first person that you sit next to, become colleagues immediately, become friends immediately, because you never know. That person might end up being your best friend with you for life. You might be best friends for 10 years, even a little more. You might end up working together. You guys might end up pursuing something else after nursing school together. You never know, but always make friends, because you need that. You might need colleagues also for study references, helping each other out. It's not wrong to do that, because there's so much information. You get so overwhelmed. The way that you can do it is, okay, you have a group of individuals. One person can do notes on this chapter and this chapter and this, and then you can all swap them. And there's absolutely nothing wrong with that. And you can help each other out. So I think that's a bit of my advice with going through your first struggle into nursing school. It's never going to be an easy path. It's never going to be an easy path. The second year in nursing school gets a little harder, because they get more into diagnoses, more into pathophysiology. There's more procedures that you have to learn. The load's a little heavier. They want you to really get into the gist of understanding what nursing is about. You're not only going to be going to class, but you're also going to be going to clinical. So there's going to be two sides to it. Plus you have to make time to study. Plus you have to make time for family or friends or whatever the case is. Right. Which also brings me to my next point, which is part-time jobs. The question is, can you have a part-time job? I can't really answer that for you. Now, when I was in nursing school, I did have a part-time job, but that's also based on how much can you handle it. If you're someone that's going to be super stressed out, and you know that you're not going to be able to manage, and time management is a very important thing that you have to weigh out. I think of it like a scale, and you can't really keep up with having that part-time job. Don't have a part-time job. Work in the summer or work on your holidays or whatever the case is, pick up something temporary or whatever. But if that's not for you and you know you're going to stress out, don't do a part-time job. It's for some people, but not for all.
Right. So what I took for some of those is, like with any degree, nursing is no different. Is learn how to learn is one of those things where a lot of folks actually don't take the time to do. Right. There are lots of even memory techniques that I would imagine in any sort of medical or healthcare. There's a lot of things that you have to memorize and you have to learn. But memorization is not necessarily learning, right? That's kind of step
No.
one. And then you have to figure out, well, how does this apply? How does this work? Where could I use this, or what are the areas that kind of link these together? So you have to start with memorization, and then you have to advance on that. And some of the things, and I think that's great advice on the friends part, where forming little study groups, having study buddies, and basically teaching each other, I think is a great way to learn, because not only do you kind of learn and retain, but when you teach others, you have to actually know what you're talking about. So other people will be like, oh, I don't get it, I don't understand, because you didn't really understand it. So that teaching of others, I think, is a great way to learn. And then on the factor of like the part-time job, figuring out your time management, your habits, and what works well for you. So some people might be overwhelmed with just schooling throughout kind of the typical fall and winter, and might have more time over summer, where that's if you need money for tuition or books or whatever it is, that's where you have your income. But for those that still need money coming in, and you just have to be diligent about managing your time and your work and your friends and your family and your own time too. That, I think, is something that needs to be thought about, where you have to take care of yourself, probably above others, but in addition to others as well. So yeah, I think all that's great advice. So what are some of the other things that folks should consider when getting into nursing school?
Well, you had mentioned about, and I had also mentioned about learning styles. And you mentioned about it's not about just memorization, which is very true. It's going to be all about critical thinking and applying that critical thinking. So back in high school, you may have studied a certain way and you got 90s and you aced it, and your report cards were like awesome, your GPA was great, and that's why you got into the programs that you all applied for. Like you mean you could have had a grade point average of like, like an A minus, A plus, whatever it is, like a 3.8 on a 4.0 GPA score, 4.0. But that changes when you go to university and college, especially when you go into nursing school. So your study habits are going to really change. It's not going to be just taking in information and simply regurgitating it back out onto paper. Now, some things, yes, but the aspect of this profession is, how do you apply it? It's going to be a completely different ball game. How do you apply that? So your study habits have to change. Which I'm going to also get into my next point, which is, when you come from high school or another program, for example, and you had great grades, which is great. And then when you go in, you notice that your grades are a little lower and they're not as high as you'd like them to be. Again, that's all based on study habits and critical thinking. Now, some you'll notice that, when you've had great grades back in high school and you go into university or college, they start dropping a little lower. And then you notice that, your colleague or your friend has a higher grade. So I guess my piece of advice would be, don't be upset with the grades that you have. Mm. And that's a really hard thing to take in, because, you're so used to being academically like proficient and getting these grades. But then when you go into a new atmosphere, things change. The expectations change, right? The standards change. So if somebody else has a better grade than you, don't compare yourself with that person. Just be thankful with what you've got. Take it as a learning experience. Think of, how can I improve myself better? What can I do better next time so I can do better on my next assignment or my next test? Or most importantly, what can I do in order to, ace my final exam and pass the course, or do fantastic in the course? Or if you're already doing well, what can I do to just keep on improving myself and just keep it that way? So I guess that would be my piece of advice, in terms of study habits and learning styles and critical thinking and grades.
Yeah, a quote comes to mind where they say, comparison is the thief of joy, right? So,
yeah.
Unfortunately, in high school, a lot of the grades are for getting into university or college, right? So you have to have something more. So you have to compare to say, okay, if I don't have a certain grade, then I can't get into the same school as Aram or Luki or whatever it is. So there's a bit of competition there. But in college, university, it's really focused more on the learning, right? So if you got a 60, 70, 80, right, that's, well, a factor of, do you know how to take the tests? But if you focus more on, okay, the experiential or like the practical components, like could you actually do whatever you're supposed to do, like put the needles in or like diagnose this or that, right? More of those real life situations are going to be helpful, and the grades kind of correlate a little bit to that, but oftentimes it's not exactly right. So there are a lot of folks who aren't necessarily like bookish smart, but do well in like a clinical hospital, whatever setting. And then others who are great academically, have a 4.0 whatever, but you put them out in the real world where they have to diagnose and triage and organize when 12 patients are coming in and they all need beds and stuff like that. Like they can't do that, right? So just being aware of what grades actually mean, and yeah, avoid a comparison, I think is a great one. So what are some other things that folks might want to consider when getting into nursing school?
So a lot of these thoughts that you talked about, like the comparison, that comparing yourself with others and comparison of grades is like a form of competition, is also a thief of joy, can really be a downer for a lot of people in post-secondary education, in nursing school as well. And like you said, it's more about the learning experience, because that's what it really is about. Because at the end of the day, you know, if I graduate with my colleague, us getting hired into a hospital is not going to be based on our grades. It's going to be based on, can we actually have that critical thinking? And that's what they, question you on interviews and simulations, and when they actually put you out there in your pre-training and your orientation. So on that note, though, when you're in nursing school, a lot of these frustrations, with comparing yourself with others, getting, trying to get the best grade, trying to really get yourself out there, whether it's personal circumstances, any other stressors, it can really overwhelm a person. And it's quite common that a lot of people in nursing school will feel frustrated, and the next option is to quit nursing school. Mm-hmm. Very, very commonly. So a lot of people will express, I'm going to quit. I don't want to do this, or they'll break down, they'll have tears. And this is not a discouragement. This is just the truth that I have to express, because it's something that a lot of my colleagues have gone through. I personally have felt frustrated at times in nursing school, and we've had long nights of studying, and we've had clinicals like all night long, like, where we're there for 12, maybe even 16 hours. And it was so frustrating because you had an assignment due in 2 days, but you have to go home, catch up on your sleep and whatnot. So I think my piece of advice would be, it's okay to feel frustrated. That's normal. That's completely normal. And that's actually very common, but maintain a healthy sense of being. Make sure that you take care of yourself. Your well-being is very important as well.
Yeah, I think that's a great point, where going back to that point about like taking care of yourself. It's one where people go through peaks and valleys throughout their life, and in school, nursing or otherwise, that it's no exception, right? So and when one thing is it's normal to go through that frustration, but to always be in a state of frustration is probably not the best thing. So think about, well, are there different ways? Can I improve things? Can I change things? Can I do something different in order to make it better? But yeah, I think that's a great point. What are some other things, or what are some other like challenging experiences that you've had that you'd want to kind of share with folks, to say, like, what, this is fairly normal, and or what are some other things that you'd also want to share about your experience in nursing school?
I think what I also noticed was that, high school life is very different. The maturity levels are different. As they say, there's Erikson stages of life. You're going through those different stages at different times. And some people hit them earlier, some people hit them later in life. It's not always necessarily, at those stages. But you have a different mindset, and when you go into university and college, you're kind of expected to be a little more mature. You're going to be working in a very difficult profession, and it's encouraged for you to be collegial. So I think my piece of advice would be to bring each other up and to encourage each other. Be collegial with each other. Don't put each other down. Don't bring each other down. That's not a really good thing, because that's not something that you would want on yourself. So I would say be a team, because that's what's going to happen. Whether you like this person or you dislike them, in the future, you're going to work together, and then your colleagues. And that's going to be for the sake of the patient and the family. And that actually will impact a lot of quality of care for a patient. So what I would encourage in terms of nursing school, but even out in the working world, is please don't create cliques and these groups and isolate people. That's not mature. That's not the way to go. Be a team. Be together, be a team, encourage each other, bring each other up, don't bring each other down. I think that's something that's really important. I'd like to continue to encourage all the time, because it's something that I have seen vastly throughout my academics, and sometimes I've seen it even in the workplace. So that's just something that I wanted to highlight.
Yeah, I think that's very true and important. Where leave all those things, leave high school in high school, right?
Right,
And
yeah.
ideally, if you can make high school less high school, and bring some of the working world or the real world into high school, that would be better, and raise kind of that maturity level. I think that would benefit a lot of folks, and the focus on positivity, and bring each other up. I'm a huge fan of that. Where oftentimes there's always two sides to the coin. You can always think at the limitations and the things that are going bad at this moment, or you could say, you know what, we have a great opportunity here. We can do all these amazing things, and you did a good job, right? So 50% could be that, well, at least you got 50 more than zero, versus, well, what happened to that remaining 50%, right? So there's always a different perspective you can take. So that's great, and making sure that you're elevating the folks around you. Don't be that downer of the group, and if you carry that through your life, that'll help as well. So. Do you have any kind of interesting stories that you'd want to share in terms of your nursing experience, to say, well, and that might not be typical, but ones that could kind of help folks kind of with a lesson or learning that they need to get into?
Like in terms of in nursing, well, what happened to me in nursing school, or you
Sure.
mean just general?
Yeah, well, probably in nursing school, but things like any particular challenges, maybe that folks could kind of learn from, or draw from your experience, to see if it relates to their own nursing school.
I think something that comes to mind is about maybe like 7-8 years ago, while I was in nursing school. My sister and I were actually hit with a very big downfall. And both my parents got really sick. My mother went in for a surgery that was supposed to be very minor, to the point that it got into complications in the OR.
No.
And like, she basically was going to have her complete thyroid removed, because they had found a little bit of cancer.
Wow.
And the surgeon, he had his scalpel in his hand, and the knife slipped by accident and actually severed her vocal cord and a bit of her artery in her neck.
Oh, wow.
And I remember waiting out in the area, like the day surgery, like the waiting area out by the OR. And my mom actually arrested in the OR. And I heard the overhead announcement say code blue. And I was like, oh my God. Because I mean, there was other people there too, but no matter who it was, I was worried. And then one of the specialist like ran out from the OR and actually came up to us and said, okay, so this is what happened. And we've started CPR on your mom. And, you know, she's come back, but we have to put, we actually have to make an opening in her a breathing tube right here. And we're going to have to put a trach in to help her breathe. And we're going to put her on a ventilator. So I think that kind of changed things. So like, you know, we were expecting she was going to be in the hospital. We were told, and she was expected just stay for maybe like a week in the hospital, like in post-operative recovery. But that had made things turn for the worse. And so, you know, she ended up staying in the ICU. She was very sick. She ended up staying there several months. My father also got really sick at the time, not as sick as my mother, but basically I was in nursing school. I was doing a part-time job. So full-time school, part-time job, managing house, you know, basic things like chores and things like that, making sure that, you know, trying to get bills paid. And my dad luckily was not sick for very long. So we were able to manage. You know, it was just all about, like I said, time management is very key, especially in something like that. So I didn't really have much time to like, you know, socialize or this and that, because I was trying to keep up my studies, trying to manage the household, and then of course managing patients. So, which was my family. So I'd be going in, I'd be helping to, you know, I'd come in and the nurses even knew me, and we'd go and help in, and we'd go in and we'd help them out and everything. So that was kind of like the other experience as well. Already I had that experience. So I was just kind of even modifying it even more. And then, you know, my father, who got really sick, he ended up with a blood clot. I already knew how to give injections. So that was very helpful. He didn't have to go to the clinic all the time, you know, making sure he got his blood work done. So I had to manage, like, you know, the dosage of his medication. I was calling his family doctor. So I was like the nurse at home, excuse me, the nurse at home, the nursing student in school, managing my studies, going to clinical, doing a part-time job. It was a lot. So it was like a heavy onus that was placed on myself and my sister. And it was very nerve-wracking at times, to the point that at a point where I almost wanted to break down. And it would have, I'm sure that would have happened to a lot of people. I was pretty young at the time. I remember staying up like long nights studying, just to catch up with assignments and things like that, because I didn't have time during the day where I had to go to class and then do this and then go to the hospital, visit mom. And then, you know, and eventually she came back home. And I think that was a very heavy pressure that was on both of us. And everybody takes their stress differently. And the pressure was always in the back of my mind, wondering, okay, is like if they were ever going to make it. And I feel like from that life experience, it taught me more about how to appreciate things and be thankful, but also how to understand people going through their battles and their hardships in their life. So that kind of made me more heavily exposed. I feel like that was not only meant to happen, but I think it was an excellent experience for me to kind of carry out my life story and its experiences to help care and have that empathy and that compassion to other people. It's not that I never had that. It's just that I think that this strengthened it. And I think it solidified it even more. And I feel that if I had lost my parents, I think my world would have turned upside down. And prior to that, I had been through some rough patches in my life, but this was a really difficult one. And I feel like this was a real true test of, you know, preparing me for bigger things, to prepare me for challenges in the future. But I really feel that strengthened me and made me the person who I am today.
Wow. Well, first of all, thanks for sharing that. That must not have been easy to kind of relive that moment. But thank you so much for sharing with that. And I guess what I'd love to hear is that for those that are going through a similar challenge, hopefully not to kind of that extent, but everyone has their own challenges. Everyone has their own problems, big or small or whatever it is. But if there are some things that like, well, what helped you get through it, right? So obviously you had the support of your sister, which sounded like that was a big thing. And then like managing your time well was something important. But are there any kind of like resources, or like what are some things that you wish you did, or something that you are so thankful that you did during that time in order to make sure that yeah, you didn't kind of collapse or whatever? Or was it just more like a timing you had to get through it, and recovery of parents or something was part of the solution? Or what are some of the things that if folks are in a similar situation, if they went through nursing school, what could they do to seek out help?
Well, one thing I would say is breathe. Just breathe through it.
Yeah.
It's not going to be easy. Take your time. Prioritize what's really important first. If you need to talk to someone, even for 5 minutes, do that. I'm someone that's very spiritual, someone that's very into like meditation and prayer. So I think that really helped me, I guess, so to speak, keep my sanity. It's not for everyone, but go for a walk, listen to a little bit of music. And again, prioritize what you need to do. You can listen to music while you're making something to eat, while you're doing your laundry, whatever little things that you need to do. And then you're like, okay, well, while things are spinning in the dryer, I can study this section for X number of minutes. And then, if you have good this is why it's important to make friends in school. Tell them the situation, tell them, not everybody's going to be open. Not everyone is an open book about their life. But if you have a close friend, someone that you can really confide in, that person can be able to help you out. Like if they have, notes, for a chapter or whatever, they can help you out. And then, you can just read those notes and study. Also I think what's important is letting your faculty know. And what I mean by that is letting a professor know. Like if you know that you're going to be so stressed out and you can't study for a test, be honest with them and tell them, this is what's going on. Can I please have a rescheduling for this exam? Or, for an assignment or anything for that matter. It's really important to try to have resources or try to have support, is more so to speak. We have family friends who have now relocated to Calgary. And I would say that they were a very great support. I consider them as like my second family. They were just like people that I could talk to. They would just even support by just even bringing something by. And they would say like, okay, you know what? Like, have you eaten? Are you okay? Mm. And just, having someone check in on you, even if it's for like 2 minutes, it means a lot. It really does. So if you're someone that's going through something, I'm really sorry that you're going through that, whatever it is. But just know that there are people out there. There are good people out there that will try to help you out and support you. And just take one breath at a time. And when I say breath, I mean that very seriously, because it's so difficult. I totally get it. Yeah. And I may have not gone through the same things as somebody else. Or someone else is not going through the same thing that I went through, but I get it. And it's really important to talk about things with people. Talking things out really helps. And if you can't talk to someone and you're someone that's very introverted, sometimes doing audio journals for yourself or even just journaling can really help. And sometimes even just reflecting on how you can try to manage things better is important. And a resource that's really great, especially for students in college and university, is please use your counseling services. They're free. They're free, and they can help you. They can help you, and they can even help connect with your professors to help you manage things, and they can really help you out. So I would say, take these things, take advantage of these things. Try to see if there's support groups out there. Make friends from day one. Friendships are not only for, a one-time thing in school. Yeah, I need your notes. No, friendships are more than that. It's about supporting one another. And like I said, bring each other up, support each other. Don't push each other down. This is what I mean when I say, please don't create cliques. Be a team, be supportive, be helpful for one another. And when I say supportive, I don't mean like just, pass notes around and this, and that. I mean, be emotionally supportive too. Try to support one another, try to understand one another. Even if you don't get it, even if you don't understand the other person, be there for that person and let them know that you want to understand them, that you want to support them.
Yeah, I think that's amazing, and I think that's probably a good place to wrap up this discussion, and just a good call to action for folks. If you're going through something right now, reach out for help, and if you're on the other side where you have someone that is in a situation, be there for them, and see if you can be that person, because that'll just help you become a better nurse in the future as well, because that is a learning experience, like taking care of your classmates, your friends, your family, or whatever. That'll kind of elevate your game and experience later on. So yeah, thanks so much, Aram, for sharing that experience through nursing school and all those amazing tidbits and useful information. And hopefully we'll get you on a future episode to talk about like getting a job through nursing school, or maybe kind of other things that would help folks getting through that nursing experience. So thanks a lot again for your time.
Thank you so much for having me here. It's been a great pleasure.
Thanks for joining us on the SWIKE Stuff I Wish I Knew Earlier, the podcast. If you like the podcast, please subscribe on iTunes, Stitcher, or wherever you found this podcast. And if you can give us a review, that would be very appreciated. Feel free to contact me on LinkedIn at Lukidanu, Lukidanu, and the same on most social media platforms. And I look forward to hearing from you. Thanks. Bye.